Matthew Carmichael. My specialty is otolaryngology, head and neck surgery. Another name for it is ear, nose, and throat doctor. I've been practicing for a little bit over 5 years at this point. Where I went to medical school, there was not an ENT residency program. So what I did was I got hooked up with a local ENT private group, and that happened probably midway through my 3rd year of medical school. And the first surgery I saw with them was a cochlear implant, which was one of the coolest things I've ever seen. And I actually followed the patient when they got their cochlear implant turned on. It's the first time the kid ever heard. So it just, at that point, I was just like, wow, this has got to be something pretty neat in medicine. So I did more research into exactly the specialty and figured out that it was for me. And then the other thing is that you see people from basically birth or even preemies to 90-year-old people. And I can see that entire spectrum, and I can pick and choose things that I like. There's so many different subspecialties off of ENT, and everybody kind of gravitates into one of them. So on a day-to-day basis in the office, patients will come in. I get to interact with them, which is one of my favorite things to do. Medicine is one thing. People come in with complaints. They've some sort of an issue, but the honest truth is that I like to get to know them. I like to talk with them. On a day-to-day basis, my biggest goal is to at least make a connection with a patient, and hopefully there's something that I can do to help them. And that's my goal on each and every day. Obviously, I don't know all the different practices out there, but one thing I do know about our practice is that each individual doctor and provider that we have gives exceptional care. We're all nice people, and we're gonna be honest with you about whatever's going on. And we're gonna do our best to help you. If there's something that we can't help you with, then we'll send you to a person that we know that we trust with your care. I want to treat patients like they're my family. That's my philosophy. It's when I talk with you, we're talking as mutual people. In other words, when we make a decision, it's a mutual decision. It's not me telling you this is what we're going to do. It's a conversation. That's what I want people to take away.